we are one of 10 schools, so we're a big university, and we're really proud to be one of 10 schools. Within the School of Health Sciences, we do strive for excellence. We have a huge educational profile, and we have a huge global research profile as well, with researchers who are globally known for. Our ethos for the School of Health Sciences is that we want to transform the lives of the stakeholders we engage with. So that's our patients, our students, our visitors, all our healthcare professionals out with the university. One of our major achievements is that we are ranked in Scotland for overall student satisfaction, but we are top for our mental health and child nursing programs. So that's a really good indication of how much our nursing programs are valued. One of the unique things about us, and this is quite important, is that we have 2 campuses. And sometimes when students apply or when they see on our website, they'll see after transitioning from ICD, they get a choice of going to either Dundee campus or Kirkcaldy campus. Dundee campus is at the heart of Dundee City, right in the middle of the campus, so we're part of the main campus. Kirkcaldy campus is about an hour away, an hour drive, and it's only for nursing students. That's the top right-hand corner there. It's a beautiful campus, and you get a lovely, really close family feeling there. There are a smaller number of students. However, I would always say to our international students to come to the Dundee campus, because you get the full university experience. You have everything on campus, whereas the facilities on the Kirkcaldy campus is not as extensive, and they don't have the benefit of mixing with other international students from across the school. Some of our international students will request to come to Kirkcaldy campus, but that's because they have family living in Fife and Kirkcaldy and they want to be close by them. But other than that, I would always recommend international students come to the Dundee campus, because they'll get the true full university experience there. So a little bit about our pre-registration nursing degree programme. We offer 3 routes: an ordinary BSc, a BSc with honours, or an MSc route. So there's 3 routes to choose from, and students will choose these routes depending on the qualification and the entry requirements that they have. Usually if students come through ICD, they'll either go directly into the ordinary BSc or the BSc honours if they graduate from ICD with high academic scoring, but the majority of them will be the ordinary BSc. We haven't had any students that's come from ICD that's gone on to the MSc route, because normally they would need a degree to go on to the MSc route anyway. Regardless of this, all three routes are 3 years, which is really unique for Dundee. And actually the BSc Honours is quite a unique programme as well, and usually that's quite additional. So it's all 3-year programme. Now we offer routes in adult nursing, mental health nursing, and child nursing. So just to say a couple of things about that. Adult nursing programme is our biggest programme, and that's where we recruit the most of our students. On average, I would say every intake, there's 1 intake a year, and that's every September. We have about 500 students on the adult nursing programme, so you can see how popular it is. Mental health is about half that, and child is even lower. Child, we only take a small amount of students, and the reason for that is for graduate prospects afterwards and for placement. There are less child and mental health placements than there are in adult nursing, so we need to make sure that we only recruit enough students that they'll be guaranteed placements. The other thing as well, because there's less child nursing clinical areas, the employability after graduation is a little bit more challenging because there are less jobs. Whereas if a student was coming into our adult programme, they have a far greater chance of getting jobs if they're staying in the UK or Dundee afterwards. Most of our international students do select the adult nursing programme because there's more choice for them for graduate prospects, for specialising, and I'll talk about that in a little while. We do have some on the mental health programme, and I think we've got 1 student in ICD that is going on to the child nursing programme, but again I'll talk a little bit about that later on. I just wanted to say that nursing here in Scotland and in Dundee is a really highly respected profession. I've been in many countries overseas, and I know some areas nurses are viewed as really important health professionals, but they're there kind of to do what the doctor tells them to do. But it's not like this here, and I think that's another reason why there's so much interest for this course. It's very valued and highly respected, and nurses are considered part of the multidisciplinary team. So their voice, their views, their perspective is all important as part of the team. And doctors, all other healthcare professionals will work with them to care for the patients. So they're not really seen as somebody to do as what the doctors say. In fact, actually, secretly, a lot of the nurses here tell the doctors what to do, and the doctors are very thankful for that. I certainly did when I worked in clinical practice. So again, all three programs, adult, mental health and child nursing, after the 3 years, they will automatically lead to an NMC registration, which is the Nursing and Midwifery Council. And what this means then is that our students will be able to work in the UK, in Dundee, in Scotland, as a registered nurse, obviously providing they're on the appropriate visa. But this will give them the registration to work in the UK. And also that we know that NMC registration is highly valued in many other overseas countries, for example, Australia. So some of our nurses go to Australia, and it's very recognised that they've had a fantastic education within Dundee in Scotland because they've been registered with the NMC. And then the option also, as I say, we go into the BSc or the BSc Honours Programme, transition from ICD. So what happens when students finish the ICD programs on successful completion, they will automatically transition into our programs.